Hello, I'm Allison Carraway. The lymphatic system, combined with the immune system, serves as the defensive system for the body. Along with moving fluids through the body, it fights infections and other diseases that attempt to infiltrate the body. But like any good army or defense, the soldiers or organs in this case can become ill or injured themselves. During this presentation, I'll depict the organs that belong to the immune system, explain the function of each of those organs, and I'll describe any potential afflictions for some of the organs that are a part of the immune system. This is a first depiction of the organs of the immune system. We start with the tonsils and adenoids found in the mouth and throat, lymph nodes found in the neck, and lymphatic vessels that will progress throughout the body, the thymus found in the chest, more lymph nodes found under the arm, the spleen found on the left side of the body, Peyer's patches found in the small intestine, the appendix situated off of the large intestine, bone marrow found in the bones, more lymph nodes found in the groin, and lymphatic vessels found in the groin as well. And I will go into more detail throughout this presentation on each of those. Here is a more detailed depiction of the lymphatic vessels and ducts of the body. We have the right lymphatic duct and the thoracic duct, as well as more lymphatic vessels shown throughout the body. I'll start with the tonsils and adenoids. The tonsils are a small but important part of the lymphatic system which helps to fight infections. However, removal of the tonsils do not seem to increase the susceptibility to infection, as most people tend to believe. Over time, the tonsils and adenoids can become inflamed, which can not only just cause general discomfort, but it can lead to ear infections, snoring, and sleep apnea, particularly obstructive sleep apnea, which can lead to loss of breathing while you're asleep, a potentially serious disorder. So as a result, a tonsillectomy is performed, which is a general surgery to remove the tonsils and adenoids. There's a short recovery period, but the patient tends to recover pretty well from the surgery. The next lymphatic system organ for discussion is the thymus, which is technically a gland found in the chest, just in front of and above the heart. It houses premature T lymphocytes that'll mature to defensive T lymphocytes or immunocompetent T lymphocytes. This organ or gland, as you may call it, starts out at its largest in babies and then continually decreases in size in adulthood, and it eventually just turns into fibrous connective or fibrous tissue in the elderly years. But it still continues to produce those defensive or immunocompetent T lymphocytes throughout life. You can notice the size difference depicted in this picture. You see the thymus gland is much larger in that of a fetus than of an adult. Here's a more detailed depiction of the thymus gland, a more cross-section or internal depiction. You have the cortex and medulla, similar to the kidneys, and it is a lobed organ. We have the interlobular septum, the thymic lobule, the thymic corpuscle, and a capsule. They are uncommon, but there are cancers of the thymus gland. They're called either thymomas or thymic carcinomas. Again, it's a rare cancer type that can develop from the endothelial cells in the thymus, from lymphocytes that actually do mature in the thymus, or from neuroendocrine cells because the thymus organ is a gland, so it does have an endocrine function. Most physicians, that would be oncologists or endocrinologists, view all types of thymomas in present day as potentially malignant, especially if they have spread or metastasized beyond the thymus to other organs. Moving further down in the body, we have these entities called Peyer's patches. They're found in the small intestine and they belong to a system called MALT, which is mucosa associated lymphoid tissue. These patches, along with other lymphatic malt organs, prevent pathogens from infiltrating the mucous membrane lining where they're located. For example, these Peyer's patches would prevent pathogens from infiltrating the small intestine. And here's another depiction. As you can see, the lime green area is where the Peyer's patch is located in the small intestine, and it is surrounded by two villi in this depiction in the small intestine. Another mold structure is the appendix, which is right off of the cecum of the large intestine. We all know this organ is just a appendage, really, that is off of the appendix, the small large intestine, and it normally just functions to trap any type of pathogens or even food particles. And it is very small in stature, but it is something that's quite minuscule, but it can become potentially deadly. As we see on the left, we have a normal appendix. As you can just see, it's a small item sticking off of the large intestine. But as you see on the right, as it becomes inflamed, it does grow in size and, of course, gets red, depending on whether there's a pathogen or group of pathogens or multiple food particles or just debris in the appendix. And it can be removed surgically and the patient can be okay, but it definitely depends on the time and fashion in which it is quickly removed because it can burst, causing sepsis and can become fatal for the patient, unfortunately. This richly red colored organ is the spleen. It has blood cleaning function in addition to its immune system function. It stores breakdown products from red blood cell production, which gives it its very characteristic dark red color. And it also stores monocytes and platelets. As we can see in this cartoon depiction, there is white pulp and red pulp. The white pulp is where immune functions are carried out, hence the color, and red pulp is where worn out red blood cells and pathogens are destroyed. And we can see that there's also an artery and vein providing a blood source and an outlet for blood from the to and from the spleen. Last but not least, we have the lymph nodes, an important part of the immune or lymphatic system. As we can see, they have an afferent and efferent lymphatic vessel system going to and from the organ or lymph node. There's a cortex, follicles, and sinuses throughout the node as well. And there's a path of lymph, which is fluid extracted from the bloodstream, where it starts with the afferent lymphatics or vessels, and they flow through the outer cortex, the deep cortex, the medullary sinus, and then exit the lymph node through the efferent lymphatic vessels. One disease that afflicts the lymph nodes is Hodgkin's and also non-Hodgkin's lymphoma. On this picture on the left, you have a normal lymphocyte, as you can see the very large nucleus characteristic of lymphocytes. On the right, you have what is called a Reed-Sternberg cell. This cell is characteristic for the diagnosis of Hodgkin's lymphoma. If it is present, the patient, along with other symptoms, is typically diagnosed with Hodgkin's lymphoma. If it is not present and there are other symptoms, the patient can be diagnosed with non-Hodgkin's lymphoma. These are also known as Hodgkin disease or non-Hodgkin disease, or just Hodgkin lymphoma or non-Hodgkin lymphoma for the man who discovered the Reed-Sternberg cell presence. They're both blood cancers of lymphocytes in particular. Another blood cancer involved with the immune or lymphatic system is leukemia. It's also a blood cancer that affects white blood cells, the ones that are produced in bone marrow. The disease basically changes the shape and type of those white blood cells, and they're unable to be used by the immune system. It's termed acute or chronic. Acute meaning that the symptoms start right away. Chronic meaning that you can have the disease for years and the symptoms develop gradually. It can be lymphocytic or myeloid, and the treatment for leukemia would either be stem cell transplants or radiation or chemotherapy and other targeted therapies. Just depends upon the type of leukemia diagnosed for the patient. This is a lymphatic vessel schematic like a capillary bed, we have arterioles and venules that have blood flow into and out of the capillary bed. We have lymphatic capillaries depicted in green and lymphatic ducts and the tissue cells surrounding all of those blood supplies and lymph supplies. Here we have how lymph flows through the lymphatic vessels. And as we know, most arteries and veins do have valve systems, but the lymphatic vessels have a large amount of valve systems. As you can see with the direction of the green arrows, when the valve is open, the lymph flows forward through the vessel, and once the valve is closed, it prevents a backflow of the lymph fluid back out of the lymphatic vessel. So there's always a steady current thanks to those valves opening and closing. And here's a histological depiction from under the microscope of a lymphatic vessel. And you can clearly see where the arrow is pointed, the valve from which the lymphatic fluid would flow into and prevent it from flowing back out of the lymphatic vessel. In summary, the purpose of the lymphatic or immune system is to circulate fluids throughout the body and fight infections and diseases. Some of the organs or the main organs of the lymphatic or immune system are the tonsils and adenoids, the thymus, the spleen, Peyer's patches, lymph nodes, and the lymphatic vessels. And some of the known ailments or diseases of the organs of the lymphatic or immune system include inflamed or infected tonsils and or adenoids that will require surgery to remove, thymomas, appendicitis, which will require immediate healthcare treatment to make sure it does not burst and spill its contents into the bloodstream, Hodgkin's and non-Hodgkin's lymphoma, and leukemia. Thank you very much for your attention.